Okay. For those of you who are watching at home, hopefully you can see this. Two very important points as we get started here. Number one is if you're at home and you're watching this, turn your volume up to make sure that you can hear me. And the second thing is that this is a really great forum for people to be able to ask questions. So if you hit that Q&A button at the bottom, you can use that to put questions in, and the questions will all save, but I'll wait till the end to answer them all. So let's get started here as we're just rounding 5 o'clock. My name is Dr. Richard Kim, and this is Richard Kim Medicine. And what I really like to do is educate people as much as possible on how exactly stem cells solve pain. And then this is the thing that we're expert at, that we're become really good at over the last several years. Let's go over a couple quick Q&As that people have asked, and we'll start to answer these questions throughout the talk today. The first one's from Sue S. From area code 585. I've got spondylitis at L304 and live every day with legs cramping, and this is not how I want to live my retirement. I can completely understand, Sue, and I'm sorry you feel have had to deal with that. You're not interested in a fusion. I was an OR nurse and aware of the consequences. I'm very interested in your idea and have done Grattan, acupuncture, AK chiropractic, all work temporarily, but pain is debilitating. I think Grattan was meant to be Graston. So definitely for you, Sue, I'm going to go through and I'm going to explain all of what we do. And through there, I can assure you we're going to answer all of your questions here. So it's a regenerative medicine review, but this is an ideal scenario for the sort of things that we do. Joan has F from area code 518, has a little bit more of a general question, and her question is learn about stem cell treatment and the conditions it's good for. Again, next 30 to 40 minutes, I'll go over this. One more from Marilyn S. from 502 said, just beginning to learn about stem cell therapy and PRP for my arthritic knees as an alternative to knee replacements. Would like to hear whatever information is offered. Not sure what my questions are until I have more information. And that's usually what happens, right, when we're learning about something new. So again, we're going to go over what regenerative medicine is and how exactly it works. Whether it's you, the patient, or it's me, the physician, we all have the same goals. We want you to avoid surgery, or you want to avoid surgery. You want to stop medications. You don't want to become dependent on these medications. And lastly, we want an improvement in quality of life, as I think Sue was saying. She's now at the point of retirement and didn't want to spend retirement this way, especially after, dedicating an entire lifetime to nursing. So certainly something we can all understand, if not relate to. The common goals as a physician is that we want to, or as patients as well, is that we want to plan. We want to plan for ourselves, we want to plan for our patients, but we want that plan to be safe. We want there to be low risk, we want there to be short recoveries, and we want to avoid pitfalls. And I think that that's what we're able to do here. Let's give a couple examples. So, the first one's a retired psychologist who flies airplanes for a hobby, runner, competitive, and also for stress relief. But the back pain ended his running. That meant no more competition, no more fun, no more stress relief, and really limited his flying time. The chef is a second example, a little bit younger, but enjoyed spending time with his family. Was in constant motion, which meant moving heavy restaurant equipment. This was really affecting his work. That made every workday difficult, to the point where he was contemplating changing careers. The problem. The problem is that conventional medicine is missing the target. The traditional treatment limitations are as such. Number one, with surgery, they're permanent, they're invasive, they require these long periods of recovery. Next, medications. Steroids, we know, are a band-aid. They might work for a little while, But unfortunately, they also weaken and damage tissue. That means repeat steroids is repeat weakening and repeat damage. Over-the-counter medications, sure, they lessen symptoms, but the moment they wear off, you need to repeat the dose, wear off, repeat the dose. And all the while, you're exposing yourself to side effects and adverse reactions. 2 months after our stem cell therapy, the psychologist returned to running. Ran the 4th of July here, a race here in town, which was a 4 mile race. Ran at a 13-minute pace, confidence enough to train for a half marathon with his grandson. And we thought that was just a really cool and amazing thing. The chef was able to go back to work full time, provide for his family. How did we do this? Well, we broke the cycle. So when you have pain, it leads to further degeneration. And if you have degeneration, it leads to more pain and degeneration and pain and so on and so on. And if we're able to break the cycle, you can stop the degeneration, but more importantly, you can stop the pain. We are the third solution, which means for us, what we have, we've got something with a high success rate, something that gives you years of relief, and it's guaranteed acceptance because we are utilizing cells from your own body. Your body will automatically accept it versus accepting cells from somebody else's body. So, what exactly is regenerative medicine? It's a relatively new field of medicine, but I'll tell you that the history of stem cell therapy goes back into the 60s. The goal here is to restore your tissues. The goal here is to restore your tissues and not replace them. That means turn damaged tissue into healthy and functional tissue. The different materials we use to restore this health of the tissue include number one, platelet-rich plasma or PRP, and number two, stem cells. Well, how do I decide which is the one we're going to use? So let's just say, for example, the green and the yellow circle are small to medium problems. Now, I'd say PRP is the thing to do. When it comes to medium or large size problems, that's when we introduce stem cells, or that's when we start talking about stem cells as the solution. Here's a good video of what it looks like when cells attack a damaged area. If red is bad, green is good. And the red is what is causing your pain, your sciatica, your stiffness, your nerve issues, shooting pains, aching or grabbing type symptoms. One of my favorite analogies is the Pac-Man idea. If the pellets are inflammation, one Pac-Man eating one pellet at a time is something like platelet-rich plasma. But putting multiple Pac-Man on one screen to go after all of the pellets or all of the inflammation all at once, that's what stem cells is like. The goal here is not to get to the next level, kind of like when you normally play Pac-Man. It's to leave the game or the entire problem behind. For how long? Depending on what we're treating, anywhere from 5 to 10 years. And this is from my own personal experience, having done this for 10 years, I can tell you this is how long we're getting in our relief timeline. So where exactly do the cells come from? The picture you have on the left is your spinning pelvis, and on the back end of that pelvis, as it's spinning now, that's the front. And in the second here, it'll be the back right there. So that back side of the pelvis, there's that bony ridge, and that's where we remove the cells from. They undergo a processing period, which is represented by the black arrow, and then injected into locations like the disc here on the right side. What does our typical timeline look like? Well, we like to start off with the consultation. We'd like to meet you, understand what your goals are, what your limitations are, what you hope to achieve out of this. Typically, somewhere after that, we do an MRI. And once you've decided and once we get started, the first PRP. Soon thereafter, the second PRP, which also includes the stem cells, and then another PRP. From there on, we're oftentimes doing physical therapy, chiropractic care, exercise. The focus here for us is to develop strength and stability. The timeline between, let's say, PRP1 and PRP3 can somewhere be around the 6-week timeline. So that's a typical schedule. Not always the same, but let's say typical. Well, what can we treat? Neck and back issues, which are probably some of the most common just in the general population: stenosis, arthritis, degenerative disc, sciatica, lower body issues, arthritis, bursitis, meniscus damage, Achilles tendon, rotator cuff, arthritis, tennis elbow, carpal tunnel, and all of these places have, arthritis attributed to various joints, and all of this can be treated as well. A lot of people want to know, am I a candidate as a patient? And I often tell people, if I can inject it or it can be operated on, it's amenable to stem cell therapy. If I can get a needle to it, I can inject it. What's important here is the diagnosis, and I can't stress this enough. Having an accurate diagnosis means having an accurate location and therefore applying the accurate therapy. If you've got this great stem cell therapy, but you're not putting it in the right place, it doesn't do a whole heck of a lot of good. Just to know, and in order for us to be 110% sure, we have our own MRI machine, which helps us ensure that we're on the right location. What if you've had surgery? The answer is still yes. We'd like that consultation early to understand what it is you had surgery for, and was it a replacement? Was it a fusion? What was operated on? How long had it been? Who was the surgeon? All of these things we'd like to know. But just like anything else, we'd like to start off with the diagnosis, imaging, of course, history, and the exam during our initial consultation is key. And of course, like I said before, the type of surgery, whether it was an arthroscopy, a fusion, a rotator cuff. Some questions we get often: where will my stem cells come from? So in this country, in the way we do it, your stem cells come from you. They come from you and go back into you. That is the only allowed type of therapy here in the US currently. How long before I can become active? Great question on this one. So right when we hit that third PRP, right after that last one, you're basically released from your restrictions. You're able to do a lot more. Obviously, for a lot of people, they're just starting physical therapy, so they're just getting back into it. And so part of that sometimes involves the physical therapist you're discussing this with. When do I feel the benefits? So I would say the majority of people feel the benefits within the first 4 weeks, but sometimes can take as long as 8 to 12. How long will the tissue stay repaired? Great question. So the tissue can stay repaired for anywhere from 5 to 10 years, depending on what we're treating. And then how well does this work? And this is the part that's sometimes a little bit difficult to answer over a webinar, but because it is very individualized. So I like to talk to people. Did you have surgery? Did you not have surgery? How active are you? These are all sort of things that are part of our factoring of how well this all works. So let's get into the questions that everybody has here for us. First one is from Susan B-K, area code 315. Herniated discs in the neck, old injury with arthritis and pain. So this is important to write the distinction between herniation versus degenerative disc disease. The way I like to describe it is as a jelly donut. It is the jelly leaving the donut. When the herniation happens, that's the jelly leaving the donut quickly, and degenerative disc disease is a slow leak out. And actually, that was what I was explaining to one of our employees today as we were doing a little bit of education. Stem cells really help keep the jelly within the donut versus something like surgery really just don't want the donut to move, but it really doesn't do much for the disc. And then therefore things like arthritis develop for people who have progressive herniation or progressive degenerative disc disease, and that's of course where the pain comes from. Ed F from 315 said how stem cells would affect herniated disc, bulging disc, and or arthritis. And then Christine St. A, I think that was supposed to be 518, said degenerative disc. And it's basically the same question as I was talking about before. So degenerative disc versus herniation. So DDD is a constant jelly trying to leave the donut. The NP, or what is called the nucleus pulposus, which is a jelly within the donut, and the AF, which is known as the annular fibers, which is the thick fibers that go around the donut. So what we're really trying to do is, again, trying to keep the jelly within the donut. If the jelly stays within the donut better, your water weight of your donut improves. If your water weight of your donut improves, it has a better bounce. It can take better load. You can stand up straighter. You can stand without pain. So all of these sorts of benefits. David M. from 802 says, I herniated, I think, a disc 20 plus years ago while incarcerated, got no help, been loving on a knife's edge. I think living on a knife's edge ever since. Turns out was diagnosed with DDD. Explains why at 24 years old the X-rays were mistaken for a 7-year-old spine. Yeah, that would do it. Yeah, not happy. Been eating just enough opiates to keep from, I'm assuming, killing myself, and that would be sad. Sorry, just trying to be honest. If you guys cannot help, I'm not going to be disappointed. Thank you for your time. Hope to connect with you, Dave. Dave, we can help. We've treated many people, as you can gather from some of the earlier slides and even some of the earlier questions. This is exactly what we do. So people who have had herniations or currently have herniations, or people who have developing degenerative disc disease, really trying to prevent that jelly from exiting the donuts. And you, obviously, Dave, understand the harm of the opiates. You're really trying to be judicious about its use, not trying to take too many of them, but always also realizing that you're quite honestly probably dependent on it just for some quality of life. But when in fact you probably want quality of life, not from just sort of escaping pain, but from things like movement, things like exercise, and that's exactly where we're experts at, and this is exactly what we help people do. Sandra M said, "What is the process and who can benefit from the stem cell therapy? Can a video consultation file for Montreal patients who have MRI and X-ray documents? What are the costs?" So certainly, so far you saw stem cell therapy in our timeline. Absolutely, for people who have chronic back pain, the kind of thing that we can do to help. Video consultation for people who do have some of that early data, MRI and X-rays. If you haven't had it, don't worry. We can help you obtain it. Obviously, we have our own MRI. What's important is that you start that conversation and have that consultation. So video is absolutely possible, even if you're not in Montreal or anywhere in the country, quite honestly. Um, the costs are all discussed at the time of consultation. It's hard to know what you need. So until we have a better handle on what you need, Sandra, that's when we'll be able to go over that with you. Scott R. from 315 said, Scott, I think, and this is somebody else writing for Scott. Scott has had 4 back surgeries and 2 in the neck. He is in pain all the time. I am Donna S., his fiance. I have permission to assist in his health needs. And good on you, Donna, for trying to help him through and navigate through some of his pain, because I imagine dealing with all of those surgeries is not fun. So this is where I'm going to tell you about something called adjacent segmental disease. And this is when fusion leads to a permanent loss of flexion, meaning that the disc above and below are forced to compensate, speeding up the degeneration. So I like to use the bike chain analogy. So if you have different links of a bike chain, and you force 2 of them to not move, the 2 on the side, if you can then see, need to increase their movement because these 2 don't move. That's what fusion does. It forces these 2 to essentially never move again. But that means the ones on either the left or right of that fusion, or up and down from that fusion, start to degenerate quicker. And lo and behold, maybe 6 months, maybe 2 years, maybe 5 years later, you've got back pain again. And so when people have 4 back surgeries, it's oftentimes because, well, I had pain, and then it wore out another level, and then I developed more pain, wore out, and then goes on, and the cycle goes on and on. I will tell you this is the most common reason we treat back pain after a what we consider a failed surgery or failed back syndrome. And sometimes this is soon after people develop soon failed back syndrome, and sometimes years later. Everybody's different and sort of present at a different time. But what's important is that you do have a very real option now to exit that pain. I want to say we recently done one in a patient in Skinny Atlas, and father of a police officer had a multi-level fusion, and in something like 8 weeks, really improved his quality of life. John from 514 said back and neck pain, arthrosis, and DADD. Again, these are the ideal problems and diagnoses that we like to treat. The solution here, what I wanted to say on this is that the solution here is really focused on changing the pain biology or the biology of pain. And if you can change how the biology of that pain is happening, turn off the inflammation, improve the quality of the disc. You're talking about an improved functional spine or an improved functional knee or an improved function of that part or region of the body. And of course, if you can improve the function, you can then improve the quality of life. Lori G from 585 said, I've had back pain since having a fusion of L1 and 2 for motion. Standing is painful. Stairs are more than 6 inches. I have trouble going up and down. 2 epidurals, minimal relief at 0405. Doctor would like to do another, but I'm hesitant. Pain goes through my thighs to the outer knees. I've also been told that I have peripheral neuropathy, and my doctor's appointment is to see if I'm a candidate for the, I think, mild procedure. Any help would be appreciated, especially if non-invasive. I almost forgot I have both knees replaced also. So again, another person with what's likely developing adjacent segmental disease and failed spine surgery. Our procedure is different. It's just different. You walk in, you have it done, you walk out, you recover from home. Lily Carroll from 585 said, help for spinal stenosis, better understand. Sorry. So help for spinal stenosis. So hopefully through this talk, you have a better understanding, which hopefully then leads you to better decisions. What's important to know about what we do is that the stem cells come from you, and our therapy is durable. When we do this, we're talking about something that lasts for years. We do it completely in the office. The recovery time is shorter than surgery. And of course, for us, MRI is part of it. So everything is one-stop shop. Everything is done in-house. Everything is done sort of without having you to go here, then there, and find data and information. We take care of all of that. Wendy RC from 315 said, what body parts can be aided financing length of treatment? As I was saying before, it's virtually anywhere. If I can put a needle there, I can treat it. So basically, needle equals yes. Can you put a needle to it? Then yes, I can. I can treat it with platelet-rich plasma or stem cells. Financing is available. When you say length of treatment, I'm not exactly sure what that means, but I think if you mean how long does it take, you saw there's that timeline of injections. From Frank M, area code 518, stem cell for both knees, bone on bone. Joanne L from 514 said, can bone on bone knee problems as well as a torn meniscus be helped? So when it comes to knee issues, so a little bit of change of gears. When it comes to knee issues, yes, osteoarthritis, meniscus tears, cartilage damage. This is an excellent alternative to surgery, and our therapies very consistently last anywhere from 5 to 7 years. Next question you might ask is, well, at the end of those 5 or 7 years, can I repeat this? And the answer to that is yes as well. And again, through my 10 years of therapy, I've had people go through our entire process more than one time. Ravi S from 315 says relief from chronic neck, shoulder, and back pain due to herniated disc, arthritis, and deterioration in spine. This is a good time where I like to talk about the broken building of degeneration. When it comes to the neck, the shoulder, or the back, or from herniations, a lot of times we're developing this arthritis, this deterioration. And my favorite analogy is if you went into a building and you started punching holes in the wall, there's debris that ends up on the floor. The way stem cells work is that they go in and they clean all the debris. They don't necessarily patch all the holes, maybe a little better so in the spine than they do in the knee, but it's the debris on the floor that's creating the pain, the debris on the floor that's making it hard to walk across the room. So if you clear that, and you can do so for 5 to 7 years, that's where the quality of life really improves. So yes, to herniation and deteriorations to your neck, your spine, and then obviously for the shoulder, a little different. Tim B from 315 said info on stem cell therapy. Pretty straightforward question. Um, I hope you see now is some very practical applications. Degeneration, arthritis, more tendon issues, rotator cuff, just like Ravi was asking about shoulder. So all of these things are treatable. Guidelines, there's certainly guidelines for everything we do, and we can fill you in on whatever it is that you're looking to treat. Mark L from 518 said, what about cervicogenic headache relief? So cervicogenic headache, assuming that what you're talking about is derived from degenerative disc of the neck, from arthritis, from stenosis. Yes, we see this quite frequently, quite commonly. We had a lengthy discussion with somebody just yesterday in one of our outer offices. And this is, though maybe not the most classic and typical presentation, as we typically hear more about straightforward neck pain, but headache is absolutely something that can happen from bad degenerative disc and bad arthritis. Just because it is a little bit atypical, and like anything else, we want that consultation. We want to have that conversation. We want to dive into your medical history. What have you done? What have you tried? What kind of imaging have you had? We may look towards getting an MRI. Tanya G from area code 514 said, my mother has chronic back and hip pain. I'd like to see if this would be an option to help her. Great, Tanya. I think one of the things I really like to talk about in both back and hip pain is the fact that back and hip pain have an overlap. Sometimes what is back looks like hip, sometimes what is hip looks like back, and sometimes you may have both problems. So here, consultation is certainly important, and for somebody who I'm assuming because your mother is aging and you're really looking for an alternative to surgery, this is absolutely something right up her alley. Maureen from 585 said, I've been told by a University of Rochester Medical Center doc that stem cell therapy cannot be useful for back pain. And I'm going to be honest on this, and I'm just going to tell you, it's more than just my experience. I think when physicians or doctors or surgeons, typically surgeons, don't have a lot of experience here, there's a bias. I will tell you that many large medical institutions who don't understand this may recommend that. Uh, I belong to the Orthobiologic Institute, the American Medical Society for Sports Medicine. There are other foundations like the Interventional Orthobiologic Foundation and many other countries who are very frequently and liberally using stem cells for back pain therapy. Why? Because quite frankly, it's easier than surgery. It's better than surgery. It's better recovery than surgery. So it's out there. It's a lot of people are using it. It's going to continue to develop. There are these massive organizations that are talking about it, studying it, exploring it. It's not just me, even though I have my own 10 years of experience. It's very much mainstream. The risk and benefit, I talked about a little bit. It's very low risk, very high benefit, and that's why it's so attractive. And if you can trade that low risk and high benefit for an improved quality of life, I think that's really the key to this conversation. Kathleen W. said from 423 said knee pain. Yep, and knee pain is one of the earliest joints that were ever studied. So very well known how knee responds to stem cells, and even in us, knees were where we had a lot of these start. very comprehensive protocol, not just for myself, but for those who are doing this out there, very well understood. I am going to say a little bit something a little controversial here, and as I'm going to say, when it comes to knee pains and back pains and hip pains, to treat them early. The moment you know that you have these degenerative issues, that the old way of thinking, just wait until it gets bad enough and do something, I think is going to go out the window. I think when you have these very low risk, high benefit type therapies, you're going to want to start treating things early. Why wait is what I'm gonna start arguing for in a lot of these therapies. But yeah, it may be controversial, but certainly in myself, I've treated my knee pains and my aches with platelet-rich plasma and regenerative medicine early. So and touch wood, I'm still doing well. Roberta B from area code 315 said questions about the stem cell procedure in knees. How does this work? What are the outcomes? Can this prevent knee replacement surgery? So as I've been saying it all along, there's excellent knee stem cell benefits, lower risk, much higher benefit, no hospitals. And part of that benefit is no hospitals. You're able to walk in, you're able to walk out. There's very quick at home recovery. We're not talking about months of rehab and endless physical therapy. It's not like that. We're talking about something that, even though it is not permanent, I would classify as semi-permanent, 5 to 7 years at a clip. And of course, at the end of those 5 to 7 years, we're talking about something that's repeatable. Mary Ann M. from 518 said, I'm interested in knee solutions, have tried many different things, want to know what Dr. Kim is offering. Again, the knee stem cell benefits. The big thing here is that it's non-surgical. There's no cutting. There's no introduction of hardware, and there's no long-term medications. Ross H. from 315 says, years ago I hurt my left knee at work. Now that knee is bone on bone. I'm wondering if you can do something for me without surgery. The short answer is yes, and the long answer is yes. With the long answer, the way I sort of love to explain is that regenerative medicine, stem cells, platelet-rich plasma, change how arthritis interacts with your body. It is not so much curing arthritis or making the bone on bone go away. It's more changing how the arthritis interacts with your body. For example, if you had a knee and by x-ray it was bone on bone, but you were able to do 85 to 90% of the activities that you want to do, doesn't matter. Do you care what your uh, x-ray looks like? And of course, most people, I'd say majority, if not all the people, would say no. They just want their quality of life. Nobody's trying to make the x-ray picture look better. They're just trying to make their life picture better. So with this semi-permanent therapy, we're really talking about something that can avoid surgery potentially forever. Jody S., again, similar questions. Success of osteoarthritis in the knees, recovering cartilage, side effects, length of therapy, cost. So again, excellent success factors. There's a couple of factors that do influence success, and part of it is not age, believe it or not, not age, but it is about level of activity going into the therapy, and then therefore level of activity coming out of the therapy. Side effect versus risk benefit ratio. So there isn't a whole lot of side effects because you're taking your cells, putting them back into you, and without a chance of rejection, it's completely accepted. So side effect is pretty low. The risks, everything's done with a needle, done in an office, no anesthesia, no surgery, no cutting. The risk goes like this, and the potential for benefit only goes up. Length of therapy, you saw our timeline. Again, cost is very much individualized. Deborah D from area code 585 said, I'm 68 years old, female, and retired. Previously type A personality and unstoppable. My current debilitating bone-on-bone knee pain has just about stopped my life. I'm sorry to hear that, Deb. Can stem cell therapy correct my situation without scheduling full knee replacements on both knees? And again, short answer, long answer, yes on both ends. The type A personalities, ooh, yeah, absolutely. That's we love that. We know you're going to follow our instructions and follow them to the T and do well. And well, again, I can't say it enough, but we're really trying to improve quality of life for people without surgery. Jane B. from 914 said, how stem cells can help with spinal stenosis. So switching gears back towards spine. So this picture here is something that I put together. When you see the blue, that's the disc. And when you see the sort of yellow, those are your nerves. And as you can see, the very tight and close relationship between disc and nerve. So a little bit of the push, whether it bulges, protrudes, herniates, extravasates, you're just pushing backwards into that area, which means that backward neck stenosis can get clearly worse. Degenerative disc, making all of that relationship clearly worse. That nerve irritation and that compression. What we oftentimes don't account for is when the disc is starting to become undone, the inflammation and then the nerve underneath it. So not only is the disc deteriorating, but it is causing a constant and chronic irritation of the nerve. So therefore, to restore the disc function, eliminates the inflammation, and then therefore removes that nerve irritation and therefore compression. Liz C. from 518 said, how can it help bone on bone arthritis pain? So this is a good one. Regenerative therapy, the way we do it is more than just about treating within the joint. It's about treating deep within the bone. So, for example, in this sort of hip joint, we would not only be treating that space between the ball and the socket, but we're treating within the bone, and we are using these materials like stem cells and platelet-rich plasma to inject actually within the bone for that deep in the bone pain. We call that an intraosseous therapy. Believe it or not, all non-surgical, done right in the office. We did one today. I think we do one tomorrow. It's a standard part of our arthritis care. Jamie S. said from 315, risk side effects, does this help with rheumatoid arthritis? So this is a good question. This is a little bit off the typical. So absolutely. So what we call autoimmune diseases, rheumatoid arthritis, psoriatic arthritis, lupus, any of those that create an arthritic pain, absolutely. We've done it for people in their thumbs, in their knees, their hips, their hands, their elbows. And even though it doesn't eliminate the rheumatoid arthritis, for example, it can help decrease that pain drastically and really improve that life there, or quality of life. And we're, again, years of relief even for those folks. Risk benefit ratio once again, and side effects are, virtually nil. Tom F. from 562 said arthritis issue. Arthritis is the very common reason for regenerative medicine therapies. Consult is important here. What have you tried? What have you not tried? What has worked? What hasn't worked? And even if you haven't tried other things, or if you have tried other things, doesn't mean that you're not ready for this. For us, it's always interesting or an important part of our data collection to understand you as a patient and what may or may not work for you. Gretchen L. from 518 said information on PRP and stem cell therapy for OA of the hands. We're talking about joints of the hand and the small joints. We have protocols, and the results are very, very similar to what we do in the knee. So, for example, we do the intraosseous therapy even in these smaller joints, regardless of severity. So, consultation is important. Talking in person is important for us to examine the joint and how stable or unstable that joint is. Katie S. from 315 asks, I like this one. So, how the procedure works to help recover mobility. So, pain matters, right? If you have somebody with pain, they don't move well and mobility suffers. So, we're really just undoing that rubric. We're reducing the pain, which allows you for increased motion. And when you have increased motion, you have improved mobility. I say this all the time to people. I can inject you for pain, not for strength. But you can't build strength if you're in pain. Lower the pain, work through physical therapy, through a gym, through chiropractic care, build strength, build stability. Better stability means keeping the pain away for better and longer. I hope that makes sense. John F. from 518 says relative success rate treating an arthritic neck. For us, this is one of the uh, ones that we've added most recently. When I say most recently, within the last 5 years, we've again, like everything else, we've sort of been able to apply this to have seeing excellent and sustained results. Our oldest neck goes maybe 4 or 5 years, maybe more. Stem cells really help in two ways, right? We talk about inflammation, reducing the inflammation. Number two, really restoring that integrity of the disc. Believe it or not, even the discs in the neck. And again, the relationship of the disc to bone is what's critical here. So the cartilage end plate. So if you can restore the disc quality and its relationship to the bone, that helps improve the nutrition through that cartilage end plate. Versus when you do something like surgery, which just means a simple fusion and just means that there's no more deterioration, but it actually hasn't done anything for the disc in between. Brenda said from 518, stem cell for bone and bone hip osteoarthritis. Again, the arthritis, improvement in the pain and mobility, years of relief, consultation is key. John A. from 315 says, how stem cell treatment can help resolve a torn meniscus and arthritis pain in my knee. I had PRP on an unrelated limb years ago, and I didn't see any improvement. What determines PRP versus stem cell treatment and how it can improve my knee issue? So you can remember our green, yellow, and red circle. That's part of it. But stem cells really are the ideal material for what I will say is meniscus tears and arthritic knees over PRP. When you talk about a torn meniscus, as long as it's not a mechanical pain and it is what we consider a chemical or biochemical pain, stem cells are great. Sometimes that takes a conversation, talking in person to determine that. Clinical severity matters more than the MRI. So if you're having severe pain, that matters more than seeing necessarily a bad MRI. Doesn't mean that the MRI doesn't matter, but when we talk about things of importance, again, can't stress enough about the risk and benefit profile. And then again, years of relief. Jonelle from 413, relief of back and hip pain, back and hip, one versus the other versus both. Talked about that overlap, and then really sometimes being able to separate the two with exam and imaging, and you may have both, and in which case both may need to be treated. Gail R.W. from area code 518 said, therapy for shoulder pain. I have no cartilage in my shoulders. So yes, arthritis of the shoulder classically has been a very difficult one to treat. But in here, for us, it is a four-step process, not the typical three-step process. It is a little bit unique in that way. I wanted to talk a little bit about a prior patient who had such bad shoulder pain, really thought he was going to end up in assisted living, just couldn't pick up anything, couldn't do anything for himself. And then at the end of going through our therapy, really felt like he could maintain his home again, be able to take care of his own house and clean up, and keep his house tidy. And he was able to, successfully avoid moving towards assisted living. Of course, if this is what's going on with you, Gail, consultation, MRI, important factors. Joyce from 514 said severe sciatica pain on my right side for 2 years on my left. Sciatica needs a diagnosis, really for you to come in and help us make that diagnosis and get you back to life. Greg R. from 585 said, learn more about stem cell therapy. Mom P. from 315 says, can the stem cell therapy treat foot drop caused from back surgery? And Yves N. from area code 518, similar question, regeneration of nerves, which cause the drop foot. So Greg R., hopefully we're providing some of that information for Mom and for Yves. So there's two important things to note here. So nerve damage, there's two types of nerve damage, that which is permanent and that which is temporary. If it is permanent, there is no stem cell therapy, there's no surgery, nothing that can be done to help improve that. If it's temporary, some of our therapies, in specific stem cell therapy, can absolutely make that improvement. So for us, it's hard to know just over this, a simple question whether yours is permanent or yours is temporary. That in-person conversation is critical. So consultation, definitely. Barry J said, do you treat ankylosing spondylitis? Do you know how to treat severe debilitating tinnitus? So AS, yes, we've done it for AS before. Consultation and imaging, there's severity in AS that's important, and we certainly need to know that about you and what sort of MRIs you've had. Tinnitus, unfortunately, the answer to that is no. Cornoyan A from area code 514. I need help with several injuries. Please contact me. For us, and through having been through this webinar, we extend a free consultation. So Cornoyan, I hope you can expect a call here within the next day or so. Drew from 518, how does Dr. Kim's practice help with compressed spinal pain? Again, hopefully you've now gathered the way we do this, the way we treat spines, the way we change how discs interact, and the way arthritis affects your body, and to really change that dynamic. Sandy from 585, slowing the progression of DDD. So this is also an excellent point. So not only is regenerative medicine helping stop the pain, it's actually helping to slow the progression, and which is also something what people want to know, right? Am I just going to continue marching on, or is there going to be some preservation? And in fact, there is some preservation. So that's a great question. Sandra said, I'd like to know more about stem cell therapy. Hopefully, you've had an earful from me now. We want to know more about your pain to say whether or not, of course, if stem cell therapy is right for you. What have you tried? What haven't? Consultation. Tom F said from 562, can nerves pinched by arthritis be healed? So nerves pinched can be unpinched. Again, when we're talking about permanent and temporary, we're talking about the temporary. Find the pinch and then unpinch that. So part of this really is about you coming in and us isolating where that pinch is. Because if I can't find the pinch, as we were talking about before, accuracy of therapy, if I don't know where to put that needle, it's hard to say simply that we can unpinch the nerve. So consult and imaging critical. Sheila said, terrible sciatica pain for 2 years, degenerative disc. So those who understand or don't understand, sciatica is very much a wire, and the wires suffer damage. They can suffer damage from the spine, muscles, a scar, at different points along the entire wire. So you have to find out where that sciatica is coming from, and then of course once you find it, then you can at least identify the solutions that may help you. And of course, a damaged wire leads to pain, neuropathy, burning. And again, what we're talking about here is a temporary damaged wire. Francine DG from 518 said treatment options, urgent need for pain relief for a torn rotator cuff and two scoliosis curves. So, in general, scoliosis does not hurt, of course, until it does. And when it does, absolutely, our therapies are great treatment options for anything that really leads to degeneration and arthritis of the pain. Rotator cuff is typically a one and done. Once we've done stem cells for rotator cuff, that's typically not a problem that comes back. Arthritis is different in shoulders, but rotator cuff typically one and done. Richard P. from 315 says non-invasive surgery for back arthritis, stenosis, sciatica, bulging disc, PRP for the back. So yes, but sometimes some of these diagnoses will require stem cell. And again, that conversation with you, understanding the severity is important. And through the consultation, we'll learn much more about you, what you can do, what you can't do, strength, and whether or not you've had imaging. Donna P. said, just interested in finding out more information on how the stem cell procedure works. She's from 585. And of course, through here, hopefully you've learned a little bit about the process, a little bit about the procedure, how exactly it works, and of course, that risk-benefit ratio conversation that we like to have with our patients. Felicia J. from 518 says, I don't have any specific questions yet. I may have questions after the webinar. Great. I think this is a perfect approach. You took the first step about learning, certainly learning more about regenerative medicine and regenerative medicine when it comes from us. So hopefully through this webinar, you've been able to pick up a few important pieces of information. For you and for everybody else out there, questions are important. And if you do have questions, ask many. Listen to the questions that other people ask. And hopefully through this, that has been one of the more valuable parts is listening to what other people have asked. Deborah M. from area code 518, how much is this and does insurance pay for it? Everyone is different and the needs are different. So when you ask us for how much this is, it's hard to know. Everyone is sorry, so the consultation is important for that part. And unfortunately, insurance does not pay for it. Hadlich from area code 315 said husband has OPLL, and I'll admit I had to look this up. So we're looking at OPLL is ossifying posterior longitudinal ligament. So it's a fairly unique problem, which I think will require a unique plan. I would certainly recommend an in-person consultation. We may even require imaging before really ultimately coming up with a game plan. But yeah, so a conversation at the very least. Tam E from 315 said process. So again, through the webinar, hopefully you've learned a lot. And you know, every person is both same and different at the same time. Experience and success rates for us have been excellent, and certainly we like to put out a high quality product and experience, and we have a very dedicated staff and office. The important facts for you are that it's non-surgical, and you know you get years of relief. All right, we're getting to the end here. So the thing I like to always offer to everybody who attends this webinar is a free consultation. The catch is that you call Friday by noon, and then you mention webinars, and then, of course, schedule your consultation. Contact information, main office is 518-871-9900. For the Northerners, it's 514-697-8919. richardkimmedicine.com, which is where you're at, but /webinars, and you can see prior webinars, and I'll give you a little hint. Most of the beginning is the same, but it's where the questions at the end are truly unique. Those are the things that are new every month. And if you're interested in just obtaining the MRI first and getting some information because you don't have that yet, richardkimmedicine.com/MRI, and you can put in your contact info and we'll call you to schedule your own. The cost of an MRI in our office is $350 US. So just to give you an idea. Our next webinar is May 21st. Okay. So let's get to some questions. I saw some questions being asked. And the first one, Anonymous, can you advise on the quality of stem cell from one's own body compared to umbilical cord stem cells? Yeah, that's a great question. So umbilical cord stem cells here in the States, there is no viable marketed product, meaning that if you wanted umbilical cord stem cells, you'd have to go somewhere else. You are now trusting the Mexican, Panamanian, Costa Rican government to control and say, yes, that clinic is truly providing umbilical cord stem cells, which is, as you could imagine, a little bit nerve-wracking. So hard to say. The studies have explored both in some of the countries that have actually taken some of the umbilical cord or what we call peri-birth product cells. The results have been promising. But again, in a lot of these therapies, it's very limited studies. There's a lot of the science that isn't clear. Um, in this state, you can only, or sorry, in this country, you can only use cells that come from one's own body. And with that, we're still able to produce quite high level and high quality results. So for the most part, I'm going to say, at this point, with what we have, we're able to produce some phenomenal results. Hard to talk about or hard to speak on umbilical cord just because the science is still a little bit lacking. The research is still a little bit lacking. Next question. It is my understanding that a torn rotator cuff involves a damaged tendon. Doesn't the stem cell therapy impact the tissue? If so, how does stem cell therapy assist with the rotator cuff issue? So this is a great question. So there's two types of rotator cuff tears, I'll say. So there's what we call a complete tear, and then there's what is called a partial tear. So there's still some portion that is still connected. So on the portion that is still connected, the kind with the portion still connected, stem cell therapy works excellent. And you layer in the stem cell in addition to the tendon, and it really does help resolve that rotator cuff tendon. It's probably one of the few places where when we do see stem cells, it is a one and done. You do it once and the problem doesn't come back. So hopefully that answers your question. So it would also would keep bear in mind that when that's the case, whether it's tennis elbow or hip tendons, same principle. As long as it's not fully torn, you can get that healing process. Wendy asks, can this treatment slow the effects of scoliosis? I have DDD stenosis as well as scoliosis. Yeah, that's a good question. I Most people who have scoliosis past a certain age usually don't have progression, but you can develop degenerative disc disease in addition to your scoliosis, so which may then exaggerate your scoliosis if I'm reading this question correctly. Yes, absolutely. The stem cells can help the degenerative disc disease, your stenosis. Will it absolutely stop it? Probably not. But with what we've seen in our patients, the slowing of the scoliosis, sorry, the slowing of the degenerative disc disease does make an impact on the scoliosis. So I'll answer it sort of from that way. Next is anonymous. Why are the PRP and stem cell therapies used in combination rather than one or the other? Excellent question. So, studies have been shown that when you combine the therapy, you get a synergy. And so, there are a couple things that we do in our office. It's not just PRP and stem cells, but a couple other things that we do that help with the synergy. So, you get a sort of 1 + 1 = 3, not so much a 1 + 1 = 2. So for us, a combined therapy is quite important. Next question is from Eleanor. Excellent, because my daughter's name is Eleanor. How does your therapy help SI joint pain? Great question. So, SI joint pain, sacroiliac, creates a joint, and that across that joint there is the biggest ligament possible in our body. So, oftentimes you develop a loosening because that ligament is loosening. Okay, so sacroiliac, the ligament spanning becomes loose. Through PRP and stem cells, it helps tighten that ligament. When you tighten that ligament, you are preventing that motion of SI joint, which is why we see such great results with SI joint. And of course, because it's not a steroid, not a drug, not a medication, and repeatable, if pain comes back, it's one of these. I probably am saying it generously, but it's one of the easier places to treat and make better. Deborah says, can one stem cell harvest procedure be used to treat two different problems like back and knee? This is a good question. So, um, I know other practices and other people do. I do not. And I'll tell you the reason why. Stem cells and platelet-rich plasma, as we're learning more and more, and this is what we've done from the beginning, and early on, I recognized it as a dose-dependent treatment. So if you draw stem cells, or one batch of stem cells, and you take half and treat the knee and half to treat the back, neither got the full dose. So for us, it is very important to take that full dose and treat just the knee or treat just the back in order to maximize that therapy. Anytime we've ever had to try to split or do a split has resulted in more failures. So we gave it up long, long time ago and only treat one area at a time. Now, with our timeline, we can overlap therapy so we can minimize the number of visits, such that when you are, for example, starting the knee, you are ending the back, and then there's an overlap. So hopefully that answers your question. Um, and that's it for questions for now. I'll hang out here for a minute just in case anybody else has any more questions. Okay. Looks like we've slowed down and stopped on the questions. Again, oh, no, spoke too soon. Eleanor's got one more. Uh, so this is a good one. Will this therapy ever be approved so it is covered by insurance? Yeah, that's a tough one. I think it's something that we'd all like to see, both as physicians who provide this and the general public. I think honestly, the my gut feeling is no. I think if you look at how insurance companies now operate, they're really working on maximizing profits and spending less. I think the idea of covering new and more therapies just means more money for the insurance companies to spend, and I think they're really looking to avoid that. A lot of therapies depend on the Center for Medicaid and Medicare Services, so it depends on um, uh, what their Medicare is willing to cover. And Medicare is, as we all know, is floundering. They're losing money rapidly. So they also are looking to cover less and less in terms of uh, therapies. Deborah said thank you, and you're welcome. Oh, there's another question. Anonymous, have you treated lung issues with mesenchymal stem cells? I'm going to ask you, Anonymous, to um, uh, call us separately. I'm going to refrain from answering that on here. I will just say there is something we are working on and we have done for people with some pretty interesting results, but I'm going to ask you to call us. Eleanor, back to, but it can mean no surgeries. Your point is well made, right? If you can do these sort of therapies and avoid surgery for the rest of your life and save the insurance company money, I don't think that a lot of those companies, insurance companies, as well as Medicare and Medicaid, have that length of foresight. I'm not sure that that's much surprising for you or for anybody else. Eleanor says, thanks. You're welcome. You're welcome. Okay, I'm gonna guess that that's the end of. Oh, no, we got one more. Stad Tlanders. Is there a waiting period for the stem cells to regenerate? Is there a waiting period for the stem cells to regenerate? I think if I'm reading that question correctly, it is when do you start seeing the results of the stem cell therapy? Again, you can see it as quick as 4 weeks. Sometimes for that 4 to 12 week window is needed, especially for those who've had scars or surgeries or they've, got particular weaknesses and particular issues. It can take a little bit longer. So, I guess the answer to your question is in general, by and large, before 4 weeks. Any other questions? Okay, excellent. Uh, Thank you everybody for attending and hope to see you soon. Thanks. Bye.